whichever drug they wanted for the control arm. The experimental arm were patients who got tarlatamab, this immunotherapy, and you could see that the patients who got tarlatamab did substantially better. Their progression-free survival was better, and the overall survival was better. We reduced the death rate at any particular time in overall survival by about 40%. So that's a really substantial advantage. And some of these patients are going to be long-term survivors, I think. This is very early data. The median follow-up on this trial was less than a year. It was 11 months. There's already a clear benefit, but I think the real benefit will be, again, the tail of the curve. We're really looking for long-term survivors here. But this has changed the standard of care, and I would consider this to be the drug to use, if at all possible, in the context of recurrent small cell lung cancer. There's been recent data, these are not FDA approved, but moving tarlatamab up into that maintenance phase looks really, really promising. Combining this T-cell engager immunotherapy with more traditional immunotherapy, like atezolizumab or durvalumab, looks really good. A one-year survival of 82% of patients, if a patient with small cell lung cancer is really very impressive, and a median survival here of over 2 years. We haven't seen data like that previously in small cell lung cancer. And even more recent data has pushed this into first-line therapy with really impressive outcome data. Small numbers of patients, early days, but I think this is changing our standard of care. The other class of drugs that I just wanted to bring to this audience are the antibody-drug conjugates. And these are sort of smart approaches. They're an antibody that's directed against the tumor. So the antibody binds to the cancer, and it's bringing a chemotherapy drug to the tumor. And the idea here is that with this sort of smart bomb approach, you're FedExing the chemo to the tumor, you're basically directing chemo where it needs to be, avoiding some of the systemic toxicities of chemotherapy by concentrating it in the tumor. And two of these drugs, I think, look really promising. One from Daiichi Sankyo and Merck, and the other from AbbVie. That IDXD is the drug that's coming forward, that's being jointly developed now by Daiichi and Merck. These are data that I just published in the JCO a few weeks ago. This is a waterfall plot. So